It's time for The Verdict. The Verdict is a lively discussion of current events and legal issues pertinent to Oklahomans. The Verdict is hosted by Kent Meyers. It's time for The Verdict.
And good morning and welcome to The Verdict. I'm Kent Meyers, and I want to particularly welcome our audience to our 150th show this morning. We've been going every week for almost 3 years now, and this is an important milestone to us, and we hope that you have enjoyed all 150 shows and will continue to watch. We call our show The Verdict because the word verdict means to speak the truth, and we think that's what our guests do. And today's show is not going to be any different. We are very pleased today, in just a few minutes, to introduce to you the Commissioner of Health in Oklahoma, Dr. Mike Crutcher. And he's going to talk to us in the first of a two-part series on health issues in Oklahoma. Today we'll be talking about public health issues, and next week we'll be talking about issues particularly addressed to our children. So we're pleased you joined us again this morning. We hope you'll keep it up. We will continue to work to bring you good shows, and let's take a break. When we come back, we'll talk to Dr. Mike Crutcher, our Commissioner of Health. You're watching The Verdict. And welcome back to The Verdict. I'm Kent Meyers, and today we're really pleased to have a guest that's going to talk to us about public health issues in Oklahoma. Our guest today is Dr. Mike Crutcher, the Commissioner of Health. Dr. Crutcher is an Oklahoma City native. He obtained his MD degree from the University of Oklahoma. He served 14 years in the Navy as a flight surgeon. He obtained his Master's of Public Health degree from Johns Hopkins University. And he's board certified in preventive medicine, as well as having the master's degree in public health. And in November of 2003, he was appointed Commissioner of Health for the state of Oklahoma. This is his first visit with us at on The Verdict. And Dr. Crutcher, thank you so much for joining us.
Well, my pleasure.
We're really pleased to have you. Been on the job a couple of months now in an agency that has 2,300 employees and a huge budget. Mm-hmm. How do you find it so far?
Well, it's an exciting opportunity. I think that the challenges before public health right now are huge and ever expanding, it seems, new challenges every day, and that certainly creates some anxiety at times in trying to meet all those needs, but it's also exciting. And I think just the potential for public health to really improve the lives of Oklahomans is an exciting challenge.
How do you manage 2,300 employees? You must have a lot of good executive help.
Well, I think everyone in a big organization realizes that you're only as good as the people that work for you. And certainly I need a lot of great people in key positions around the state, both here in Oklahoma City and around the state, to make it work well. And fortunately, I've got a lot of good people.
We've seen just enormous changes in my lifetime and to some extent yours in public health issues.
Right.
Diseases that were scourges of this country have been eradicated through vaccinations and so on.
Right.
What would you characterize as the 2 or 3 greatest accomplishments of public health in the last 50 or 75 years?
Right. Well, you know, that's a great question. It's an important thing for, I think, all of us to understand, because sometimes we lose sight of what those accomplishments have been. But certainly the control of infectious diseases is something that I think is right up there at the top. You know, you only have to go back a few decades in this country when there were many of the diseases that now just do not occur. We do not see that, you know, caused hundreds of thousands of cases of disease and thousands or tens of thousands of deaths in children primarily, that have just been eradicated through vaccination programs primarily, and sanitation programs. And certainly other diseases which have been improved because of control of the safety of the water and the food, inspections of restaurants and other places where diseases can be spread. and our ability to rapidly identify infectious disease outbreaks through our surveillance systems and then investigate and intervene have just dramatically decreased the morbidity and mortality associated with those diseases in our population.
Well, as growing up as a youngster or an early teen, polio was a huge scare in Oklahoma City and around the country generally. Sure. I had a good friend die of polio, and another good friend who was seriously afflicted by it, and now polio is basically gone, I guess.
Absolutely, just gone. We do not see polio, and hopefully polio will soon be eradicated from the world. That's an attempt, as we've done with smallpox through immunization programs. But we don't see it in the United States at all. So absolutely, one of the huge achievements of public health is not only just eliminating that disease, but also diseases such as measles, mumps we rarely see anymore, diphtheria, pertussis is rare to see. So all of those diseases of childhood have been virtually eliminated from our population through immunization programs.
I know your department works hard in getting information out and ensuring that mothers-to-be get appropriate care and treatment during their pregnancy period.
Right.
Have we seen changes in the health of babies being born because of that?
Well, that's certainly another one of the great achievements of public health is to improve the health of mothers and babies and to decrease the number of infants and children that die early in life. And absolutely, that's been a huge improvement by identifying mothers early on, making sure they get the appropriate care and appropriate education that they need, and other interventions that just increase the likelihood that they're going to give birth to a healthy child.
Now, you're in kind of a partnership, if you will, an informal partnership with the caregivers, the people who actually treat in the hospitals and the doctor's offices.
Right.
How do you, as Commissioner of Health, interact with the everyday caregivers that have to do the real treating work?
Well, I think just communication and collaboration is a key component of public health. And there's a public health system which basically includes everyone that affects health in the state. And we are the public health agency and certainly have the responsibility for leading those efforts, but cannot do the things that we need to do to maximize what we can achieve with public health without interacting with all healthcare providers in the state to provide the services that they need that affect these preventive and public health concerns.
What kind of effort does your department or your employees, what kind of effort do they make to get out information to the general public about hazards that might be on the horizon?
Right. Well, that again, the big part of what we do is we have to pass on information quickly. We live in an information age, and people expect the rapid distribution of accurate information, and that's a big part of what we try to do. A big area of late where that has been most important has been in the area of infectious diseases, whether that be West Nile virus or SARS or bioterrorism or the recent influenza problem we've had in the last few months. That's a big part of what we do. And we do it in many ways, certainly taking advantage of the newer technology of using internet capability, email capability, websites are critical. But then some of the old-fashioned way, too, of interacting with the media regularly, of going out and doing lectures in public to health groups and public groups is something we continue to do also.
And I suppose you have a not insignificant relationship with the legislature.
Well, it's critical. Public health obviously is it's part of the political process. We spend public funds, and a big part of the greatest achievements that we've achieved in public health have been through policy, through laws and rules and regulations. So we need to interact well with the legislature and maximize our ability to use policy to improve the health of the population.
Well, why don't we get ready to take a break, and when we come back, I want to ask you a little bit more about some legislative things that may be forthcoming this year.
Okay.
Let's take a break. We're visiting with Dr. Mike Crutcher, the Commissioner of Health for the state of Oklahoma. We'll see you in a minute. welcome back. I'm Kent Meyers, and we're pleased today to have Dr. Mike Crutcher, the Commissioner of Health of the state of Oklahoma, on visiting with us about public health issues. On January 27th, Dr. Crutcher, Governor Henry announced what was phrased as a sweeping initiative in the health area, and it basically had three main subjects. It was to a program to provide medical care or insurance to uninsured Oklahomans, to establish a world-class cancer research center in Oklahoma, and finally to deal with the statewide trauma center problem in some sort of meaningful way. Right. I presume you're going to be involved in some or all of those activities should the legislature enable this to come about.
Yes.
Well, let's focus first on the uninsured. Right. The governor's press release indicated that 1 in 5 Oklahomans does not have health insurance. Right. What kind of a problem does that make for your department?
Well, certainly the ability to get medical care early in a disease process is important from a preventive perspective, and you know, I think everyone wants to have access to health care. You know, this is not a problem that is just in Oklahoma. Obviously, there's a national crisis that has to do a great deal with the continued increase in the cost of providing health care. That is just climbing steadily, and we have to get that under control nationally and how we finance health care. But certainly any problem related to that is going to be made more significant in an economy, you know, by poverty. In any state or any community where there are large numbers of persons that live lower on the socioeconomic scale and don't have the money to buy insurance or to provide medical care for themselves, it's just going to be worsened. And certainly Oklahoma is a relatively poor state compared to many other states. So our problem is going to be compounded in Oklahoma for people not having access to health care. Well,
the press release again went farther and stated that the 1 in 5 number, 20% of all Oklahomans don't have health care, right, was among near the top of all states, right, insofar as being uninsured.
Right.
Do you attribute that relative ranking near the top or the worst, if you will, as basically an economic problem? Is that how you'd tag it?
Well, I think that's certainly you know, high on the list of the problems that's causing that. I mean, I think we need to look, as Governor Henry is looking at doing, is what we can do in the state to improve that with the means that we have here. But health care costs are huge, and it is only going to continue to get worse. Excuse me. So we need to continue to be looking for ways, and this is certainly one way to increase the ability to fund health insurance for the population of Oklahoma.
The second thing that was mentioned in this health initiative is the establishment of what was called a world-class cancer research center. Right. Where would that center be located?
It would be located on the OU campus in Oklahoma City.
The Health Sciences Center?
Right, right.
Is there an existing center there now?
Well, there certainly is the infrastructure is beginning, and there have been buildings going on there that would contribute to that process, but there's additional building that is going on right now that would form the core of the cancer center.
Should this initiative be favorably received by the legislature and all the matching funds come into being, when could
right,
one reasonably expect on a timetable to see that cancer research center up and running?
You know, I have to say I don't know what the timetable is. OU is primarily in the lead on that, but there certainly are buildings and efforts that are underway that would support that are ongoing right now. But you know, a tremendous amount is dependent upon actually getting the funding
yes,
for this and getting the approval for a cancer center status. And so there's still some work to be done.
Yeah. Well, if Dr. Ferretti's involved in it, it'll get done, and it'll get
right,
done well, I suspect.
Yeah, he is.
Let me ask you another question about the trauma center.
Right.
We've been hearing a lot about it in the newspaper and on television about how the only existing trauma center was on the verge of shutting down, and it took some efforts by the governor and yourself and others to make sure that didn't happen. Are we still in danger of losing a trauma center?
There's still a lot of work to be done. There has some money has been put into this to keep the trauma center at OU open for a period of time, approximately 6 months. but there are still significant issues that have to be addressed. The Board of Health a couple of weeks ago passed some rules that were the first step, I think, in establishing a system of trauma care. You can't just have a trauma center without having a system that cooperates with the trauma center and coordinates the care of people with many different levels of trauma injury. So there's still a lot to be done. I think that some initial steps have been made to get us going down the right track, but certainly in this legislative session that's getting ready to start, there will be some additional statutory issues that need to be addressed and obviously some funding issues that need to be addressed.
Is a single trauma center enough for Oklahoma?
Well, certainly there are other states. Wichita, Kansas has 2 trauma centers.
Really?
Level 1. Now there's different levels of trauma centers. So you know, the higher the level, the more ongoing care and immediate access to trauma care that you have, with level 1 being the highest. Certainly, you know, having 1 in Oklahoma City and 1 in Tulsa would, I think, cover the state well.
Is that a long-range goal to have another one?
You know, we'll have to see. I mean, I think a lot of this will be dependent upon what happens in the next few months in the legislature with, again, some of the policy issues and with the funding issues as to whether that's feasible to support that, because it does not come without some significant commitment in resources to maintain that system.
Some of the information I've read indicates that perhaps this initiative is going to be funded by an increase in cigarette tax or an increase of what someone has to pay for a package of cigarettes. I suppose you have some feelings about that, being in public health and seeing what kind of challenges smoking brings to you.
Absolutely.
What do you think about that?
Well, you know, I think if long-term we want to improve the health of Oklahomans, because you're probably aware in the last several years there's been a lot of information in the media about how poor Oklahomans compare health-wise to other states. And if we're going to change that, we really have to intervene in some of the core problems that are resulting in these poor outcomes. And without a doubt, use of tobacco products is one of the main problems that we have in Oklahoma, in addition to inactivity and poor diet and being overweight, which I know you'll talk about next week.
Yes.
So anything that we can do to decrease the use of tobacco products in our population will be put us in good shape to do that. And without a doubt, you know, we need to focus on kids and keeping kids from starting to smoke. And it's been clearly shown that the price of cigarettes is directly related to the ability of kids to buy cigarettes and get hooked on cigarettes early in their lives. So tobacco tax would certainly decrease the ability of children to start smoking.
The last few seconds we have, what do you hope to accomplish this next year, Dr. Crutcher?
Oh, there's just so many things to do in public health. You know, obviously, ultimately, we want to be looking toward improving the health of Oklahomans, to increase the longevity of Oklahomans, to decrease the number of adverse outcomes that occur in Oklahomans' lives that, you know, result in disability or early death. And there's just 100 different ways to go about that and 100 different challenges that we need to continue to focus our efforts on to make Oklahoma a healthier place. Certainly the big challenges that has been laid on our plate recently has been preparing for terrorism, bioterrorism, and other forms of terrorism and emergencies that we also have to invest significant resources in to make sure we're ready to respond if needed.
Well, we wish you good luck. We thank you so much for joining us.
My pleasure.
We're going to take another break, and we've been pleased to be talking to Dr. Mike Crutcher, the Commissioner of Health of the state of Oklahoma. We'll be right back. Welcome back. We were really pleased today to have Dr. Mike Crutcher, the Commissioner of Health, new on the job, only 2 or 3 months now, join us on the verdict and talk about public health. You know, public health has given us an opportunity, an underlying opportunity to live a much better, longer, healthier, safer life. And it's, of course, up to each of us to take advantage of those opportunities. But Dr. Crutcher, his predecessors, people in the public health department in the state of Oklahoma, have done just a wonderful job in making each of us have an opportunity to do better with our living and be healthier, take better care of ourselves and our families. And we are very thankful for all they do and the hard work that they give to us each day as citizens. Next week we're going to continue the with our second show in the series on health issues, and we will be talking about kids. We'll be talking with Stanley Hupfeld, the Chief Executive Officer of Integris Medical Center, and Ann Roberts with the Oklahoma Institute for Child Advocacy about the Fit Kids Coalition. We'll be talking about health issues for our children, and they are every bit as significant as the issues we've been talking with Dr. Crutcher about. So I invite you to join us next Sunday to watch that. And as always, we encourage you to come onto our website, theverdict.tv. Tell us what you'd like to see. Give us your opinions about anything. We'll respond to you if we possibly can, and we usually do. And we take your ideas and we take your comments seriously, so please join us on our website as well. As you might have already guessed, I'm going to say one more time, go Heritage Hall, Lady Chargers. Join us again next week for another show, The Verdict. We appreciate you being here. Thanks.